I wanted to ask you guys for your board, for your CBIA, what is the percentage of the board members who are are of a small business background, like less than 50 employees?
Less than 50? I'd have to get you that number,
Yeah.
Senator. I mean, it's probably more than half of our board. 95% of our members are under 100. I believe 87% of our membership is under 50. So the vast majority, you have to be a member in order to be on our board. So the vast majority of our board and our membership is under 100 and quite a few under 50.
Okay. When I looked at the list of your board, it didn't seem like that. There are smaller groups, but it did not appear like that. The other part was, how does one become a member?
They join. We're a dues association. So they would just, decide to join CBIA, either paying through our mission, which is advocating for economic growth and competitiveness in Connecticut, or certainly they could want to join because they want to benefit from some of our member programs, whether it's our health insurance, property and casualty, membership discounts, energy, workers' comp. We provide a lot of programs offerings for businesses to lower their costs and remain competitive.
Okay. And do you have an understanding of how many of your member companies have employees that are Ellis employees?
I don't have that number off the top of my head.
Okay. Well, this is a fastest growing segment.
I'm sorry, Senator, you're breaking up a little bit.
Sorry, you know what Ellis is, right?
Yeah, you were breaking up. I couldn't hear you. I'm sorry. Yeah.
Okay. So this is the fastest growing segment in our state. And these are all employed. So statistically speaking, they are individuals employed by your members, which means that the way the employers have set up a mechanism that they have employees that are working full-time, but they're not even able to afford a single meal at a restaurant once a month. And of course, I mean, as credible and committed you are for the business industry, the businesses are only as good as the employees are. I mean, you know that's like basic 101 on the business end. So I know that the board is very set towards the top positions, and that makes it look very nice that it's a powerful group. But the power of the executives comes from the people. And if you do not connect those things, then they are living in two alternate realities. So I would, and that's where I believe CBIA has a very big responsibility, a moral responsibility and a sustainable responsibility to make sure that your members, because your members are the executives, the people who are working are not your members, unfortunately. But if the people are left behind, the industry is going to suffer long term. And then that's where we have to have an investment in the people. And if you look at the new businesses, which are smart, and you know this, I'm just for the most part, but you know the fact that when a new industry comes, they look for the workforce before they look for anything else. And what I see is that having an effort into the workforce and the quality of life of the workforce and their health and their personal life sustainability is going to be critical as an ingredient for the business industry. And I think that's where at times I sense that the CBIA is at a different frequency and not interacting with the people on the ground. Because every single workforce related bill, you guys have officially been against. And when I talk to you, you agree with it in private at times, but then and when I look at your readings and I say, oh my God, is it the same people? And I get confused because when I interact, you guys are such kind and nice and smart people. But then I look at your documents and then the secondary conversations from the executives, and I say, I don't know what is true or what is not. So I'm just sharing because this is a good opportunity to share my concern, because every single bill that I worry about for the Ellis community, the people who are voiceless, the people who are working full-time, I see CBIA not coming in and saying, yes, we are with the workforce. And I just want you to please consider that, because your executive, if they tell you that we are only and only and only interested in our bottom line and not in the workforce, you have a responsibility to educate them that their industry is dependent on that workforce and the well-being of that workforce. And I believe this bill is a step in that right direction, even though imperfect, but it's still a step in the right direction to try and address that. So, and again, I've said quite a bit right now. And these are philosophical aspects, and I'm hoping that maybe I'll be able to get into your hearts, not necessarily the minds, but the hearts at least.
Well, if you don't mind me responding to that, Senator Anwar, I mean, we haven't met yet, and I've been here since August. I can tell you, I ran a family-owned business and grew from 40 people to 150 people over 18 years. You could call any one of my former employees. I have a great relationship with them. I've probably met more small business owners than anybody who's been before you today. Thousands in my 18 years of running business, friending companies. They treat their employees like gold. What you said is absolutely true. The business is only as good as their employees in the workforce. And I'm proud to say in Connecticut, we have some of the greatest businesses because we have the greatest workforce in the world. So I believe CBIA does bridge that gap. A lot of the benefits we offer aren't for the employer, they're for the employee. They're for the employee to spend less on property insurance, auto insurance, to have a healthier life through a wellness program. So a lot of our benefits are actually geared towards the employee because the employer wants to have happy and healthy employees. The employers in Connecticut really care about their employees. And I could say the employers in Connecticut do that more than many other states. I ran businesses in Seattle, in California, and in France. I didn't see that love, that compassion, that embracing of the employees like I see here in Connecticut. So I would be happy to talk further about that one day. I believe CBIA does bridge that gap.
Look, CBIA, when they look at my score, you guys evaluate everybody, and I don't score very well because I work for the people, and I don't work for the executives, which is fine. I take that but you're new, so maybe there's going to be a culture shift that may happen, and the time has come for the rest of the world is waking up to it, and it's about time we do it as well. The second question I wanted to ask you was, look. I have a master's in public health. I do public research at times, and I've been involved in some of that aspect. You ask a question in a manner to get the answer that you want. If people want to do this. So when I see your study saying that 69% of I guess your businesses that are connected with you, they are opposed to a public option. I would love to know how that question was asked, because you're not in your website, it doesn't say that, but I just heard you say 98% of the people are not happy with the way the healthcare costs are, which was interesting because that's something that should have been mentioned in your website as well. Maybe I missed it, but when you say 69% of the people are opposed to public option, that tells me, how was that question as asked? It was, and that maybe give us a glimpse what answer you were going to get or you're looking for. Because when I interact with the businesses in my community, they are really worried about healthcare. They're really worried about the cost of healthcare. And then they're looking at all options, and they're really not married to any idea. They just want to make sure that their workers are taken care of. But then I look at your website and they say, oh, well, almost 70% people don't want this. And I say, wow, this is amazing, because we are completely indifferent. And then I say, okay, maybe none of the people that I'm interacting with are part of CBIA, but then you claim to be there too. So it's really confusing, but I thought I'd just put this there as well, because that is giving a wrongful perception to people that there is no healthcare problem.
Well, I did say, Senator Anwar, in my testimony, but it's also on our website, 2 paragraphs down from the 69%. It says 98% of CBIA small businesses surveyed that they were very or somewhat concerned with rising healthcare costs. It's right there on our website, just a couple of paragraphs below the 69%. And I even put it in my testimony as well. Healthcare costs are a major, major, major issue for Connecticut businesses. small businesses, medium, and large. And we need to address it. And as Wyatt said, we're here. We're not just here to say no. We're here to offer alternative solutions and work with you all. And there are some really good alternative solutions. We can and we have to lower the cost of healthcare.
So, and if your board, which obviously is the one that controls the organization, has executives from the insurance industry who have been very clear where they stand, what are the chances that you are going to say, you know what, public option is a reasonable option?
95% of my membership is under 100 employees. 87 is under 150. Yeah, it's under 50 employees. Do you think I'm going to win? This is the 95% of my membership or 5% of my membership? I'm going to listen to the 95% of my membership that's under 100 employees. We are here opposing this on behalf of the small business community, not the health insurance.
No, but I thought the board governance is from the board, right? Or it's different governance?
No, our board does govern us. Yes, our board is here to govern us. But
and
as I said in my testimony,
executives of the insurance industry, right?
Yes, some of the insurance industry on our board, some of manufacturers on our board, some of professional services on our board, construction industries on our board. We have a very diverse and robust board.
I know. So, and that's what makes it a little tricky. Again, I understand how these big groups work, but I want you to keep that in mind that I look at your studies with a little bit of skepticism because no board is going to say that where their own business is going to be impacted, because it's all about protecting the business. And end of the day, that's why CBIA is about. And I respect that. I understand that it's necessary. It is and I'm interested in the balance, and that's what my interest is. And I think the balance is not there right now because if you look at the statistics of the ALICE community, that is increasing. If you look at the number of people in the last 10 months, what has happened, the entire thing has shifted in a direction where we cannot afford to have business as usual any longer. And that's why we have to start thinking of options and real options, and then present real solutions going forward. So again, I truly appreciate the opportunity to talk to you. I was getting like sleepy and tired, but as I heard your testimony and I'm just awake again now, I'll be up all night. So thank you so much. Thank you for your testimony. Thank you, Madam Chair, for the opportunity.
Thank you, Senator.
Wyatt, thanks for coming here tonight so late. We really appreciate you spending all this time with us. Thank you.
Thank you, everybody.